Hello, my name's Stella Wright and I'll be presenting on behalf of the APP Pacesetter project team. The presentation is titled More Than an Extra Pair of Hands, the impact of the Advanced Paramedic Practitioners, or APPs, in primary care. UK ambulance services are under pressure to retain paramedics as diverse career options become available throughout the NHS. Rotational working can provide a varied clinical portfolio with the aim of sustaining a longer ambulance service-based career. Betsy Cadwallader University Health Board and Welsh Ambulance Service, known as BCUHB and WAST for this presentation, were awarded Welsh Government Pacesetter funding to undertake the project. Pacesetter funding is allocated to health boards to provide a systematic approach to testing and evaluating new and innovative ways of working to achieve the aim of the Primary Care Fund, namely improving access, sustainability, and delivering more care in the community. 9 Advanced Paramedic Practitioners, also known as APPs, were appointed onto the Pacesetter programme in 5 primary care cluster areas in North Wales. Since June 2019, they've worked on a 3-part rotation incorporating primary care and shifts in the Clinical Contact Centre and solo responding for the Welsh Ambulance Service. The model of implementation has been different in each of the cluster areas, and the APPs offer a mixture of home visiting and surgery clinics. A logic model approach was used to develop an evaluation framework comprising 7 core areas. This presentation will focus on how the first year of the primary care rotation has impacted on the APPs, primary care and WAST. The remaining items are being evaluated by an external partner. The 3-part rotation is represented by the image on the left, and data was collected using a mixed methods approach. Cluster representatives completed an online questionnaire reflecting on the implementation of the project, and several cluster coordinators and senior coordinators joined a focus group to discuss the project from their perspective in more detail. APPs have completed daily activity data and the Minnesota Satisfaction Questionnaire. However, this presentation will mainly focus on qualitative findings from their reflections. Since June 2019, the APPs have undertaken almost 4,000 patient consultations, 2/3 of which have taken place outside the surgery setting, i.e. in patient homes or residential and nursing homes. The findings from the clusters links back to the APPs being seen as more than an extra pair of hands and providing an invaluable service in primary care. The APPs were found to relieve pressure on surgeries and release GP time, enabling GPs to focus on more complex cases in surgery. Other benefits included integrated working with Public Health Wales and WAST, and recognising how the service delivered by the APPs can benefit patients and has the potential to avoid hospital admissions. The APPs have completed reflections on their learning and supporting others. A number of themes were identified and some are illustrated by the quotes on this slide. These include the importance of GP supervision whilst becoming established in primary care, a shift in practice whereby APPs are having to think differently when delivering holistic care. APPs reported improved clinical and communication skills and being better able to identify what matters most to patients. The APPs were also introduced to a new way of thinking about managing risk and risk perception, which was raised repeatedly in the reflections. However, the APPs did also recognise that risk is inherent to the role in primary care. In addition to the 3-part rotation, APPs also undertook half a day of formal education each week. Feedback has indicated that the APPs found the education to be effective. In addition, it was cited as an important source of social support as the APPs became established in primary care. Originally, the project team had planned to capture the impact on WAST through quantitative measures, but it was difficult to demonstrate an effect in a wide geographical area with such a small number of APPs. However, the qualitative data was able to capture the impact the primary care rotation had on WAST shifts from an APP perspective. Examples include the benefit of integrating with multidisciplinary team members and improved awareness of services available to APPs and their patients. And the quote on the right was from an APP who reported that additional skills acquired in primary care had improved their efficiency in developing management plans on WAST shifts, which resulted in shorter time spent on scene. So, what's next for the project? Early findings have demonstrated that the APP rotation into primary care is having a positive impact on the APPs, on their work in WAST, and for primary care clusters and their patients. It has also helped highlight areas for focus in future as the project progresses. Phase 2 will run from September 20 to March 2022. There will be double the number of APPs from 9 to 18. 2 additional primary care cluster areas will be coming on board with the project. There will be changes to the model of implementation and evaluation framework as a result of data collection and analysis undertaken during Phase 1. Examples include a greater focus on the impact on WAST in Phase 2 and introducing APP surgery clinics earlier in the process. In the longer term, it is anticipated that the findings from the project will inform recruitment and retention planning for both WAST and primary care clusters in North Wales. And here are some of our APPs from the first cohort who are at the centre of the project. If you'd like to get in touch, our details can be found at the bottom of the screen. If you use the QR code on the right hand side, it will link to the website where you can find out more about the project team, see the latest updates and listen to our new podcast series. Thanks for listening.